and over to you, Aishwarya.
Hi, everyone. Welcome to the session. Aishwarya, next slide, please. Thanks for joining us on a session on menstrual health and hygiene. We have a number of excellent presenters here to talk about their work. Before we delve into their presentations, however, I just wanted to go over a couple housekeeping things. Many of you who may have attended the session in past years knows that the chat function on Zoom is disabled, so you'll have to navigate back out to, or in a parallel window, don't go out because you might not be able to get back in, to the chat on the Pathable platform to put your questions there. We really want this to be an interactive session, so please put your questions there. Through the presentations, we'll compile them and tackle them in mid-session Q&A session, as well as towards the end of the session. On that page, we also have a number of resources that pertain to the presentation, so please access them to your leisure if you haven't already. And without further ado, I'm going to pass it over to my colleague, Dr. Bethany Caruso, to get us into the work. Over to you, Bethany.
Great, thank you. And thank you all for joining us today. I have a great pleasure and honor of introducing this session. And I just wanted to start, I know most people here are already well aware of the work going on around menstrual health and hygiene and some of the history, but I think it's important to revisit a little bit, especially as we consider measurement. And so menstruation has been recognized by the WASH sector for a long time now, far longer than any other sector. And specifically almost 10 years ago, it was considered important to think about for measurement in regard to the Sustainable Development Goals. And it is from that work, from a small group of people getting together, considering hygiene for the SDGs, that specifically drove the development of the MHM definition. And so if you can move to the next slide. You know, many of you are well aware of this definition, but perhaps not its history, but the specific history is founded in the fact that we needed to have a definition in order to push measurement on this issue specifically related to what is now SDG 6. Even though it didn't find a place, it has continued to inform especially the WASH sector with this definition, but even beyond. So moving forward to the next slide, we see that the definition has also evolved. People have thought about this definition, and maybe that menstrual health and menstrual hygiene management is perhaps not the most inclusive term of all that we should think about in terms of menstruation. So the conceptualization and definition of menstrual health has now also emerged and evolved. And if we can go to the next slide, what you can see with this definition, it's far more exhaustive, embodying a lot more concepts than the original definition. But what I've highlighted in blue are the pieces that remain from that original definition, the pieces that are also quite specific to WASH. So WASH remains a critical focus and a critical part of this definition. But what we see from the definition is also this expansion of what menstrual health and menstruation means and why it's important for us to think about. When you expand a definition, there's also a lot more to think about, a lot more to assess, a lot more to see, and a lot more to measure, which brings us to the next point. So if we can advance once more. With the evolution of definition, at the same time, measurement has also evolved. And this might not have been getting that much attention publicly right now, but there's a lot of work going on behind the scenes, which is why it's really great for us to sort of take this opportunity with you all, present the work that's going on at this moment that you can all keep your eyes out for in the coming months and years as more of this work becomes public and data comes in. And so going on to the next slide, I just wanted to take 1 second and talk about why is measurement important. It might be quite obvious to some of you, but it also might seem like a bit of a dry topic, but I assure you it is not. So moving forward, I've used this slide before in previous measurement presentations, but I really think it's worth resurrecting. And I like some of the text here, which I think is important to illuminate. And so specifically this line where it says people measure what they treasure. And this is really important and true, because one of the things that we need to think about is what we actually collect data on. What we often collect data on are things that we think are important, things that we treasure. As a result, when we are able to measure, we are also able to count, to make visible populations and experiences that might not have been countable before, that might not have been seen before, that might not have been visible before. So there is an element of transformation that can come from data measurement and collection alone. And I also wanted to highlight this other point, that research outputs that carry greater meaning and potential benefit for more people in more parts of the world. So measurement goes beyond just counting. It actually can enable change. So more than simply measuring, more than just collecting data, we have to also think about how we then use the data, how we advocate with the data, and how we aim to make change and influence and continue to value and make visible and keep visible those various populations we work with. And that's especially true in menstrual health. For those of you who've been in this conference for many years, you might remember that years and years ago, what we talked about with menstruation was breaking the silence. We're not breaking the silence anymore. We're actually moving well beyond that into counting, making more visible. So on to the next slide. I just want to give you a quick rundown of our run of show. The primary aim of this session is to highlight all these efforts underway to improve measurement. And this includes creation of indicators for monitoring in menstrual health and hygiene. And so what we will do, onto the next slide, we will first have one lightning round. And this will have 3 short 5-minute presentations on global MHM monitoring by the JMP, making progress on measuring menstrual health and hygiene by the Global Menstrual Collective, and specifically focusing on menstruation in the workplace. We'll then have a moment to have some questions and answers, specifically for those presentations in the lightning round 1. Then we'll have a second lightning round of more extensive presentations that are 10 minutes each on MENSES, menstrual-related engagement, self-efficacy, and stress, and then also the menstrual practice and needs scale. And then we open it up for discussion and also some remarks on the way forward. So I'm going to turn it back to my colleagues, and thank you all for joining.
Thanks, everyone. We'll start this session by focusing on a presentation from Christy Chatterley. Pass it over to Christy now.
Thanks so much. I have the pleasure of presenting on behalf of the JMP team. So the Joint Monitoring Program, which is a joint effort with the WHO and UNICEF, they produce internationally comparable estimates based on national data on WASH, and these are published every 2 years. And our database have a lot of data sets on drinking water and sanitation, as you can see in this slide. And we've been monitoring those elements since 1990. So we have a lot of data. We recently added hygiene for the SDGs. And then just last year, very exciting, we officially added menstrual health to the JMP global database. And we already have 46 data sets, all from household surveys, which have been progressively including more and more questions on menstrual health and hygiene. And on the next slide, if we look at some of the indicators that are coming out of these household surveys, they can be grouped into 4 areas for the most part. For the first, it's awareness of menstruation before menarche, which we have data on from 2 countries. Then we have data from 39 countries on the use of materials to capture and contain menstrual blood, and access to a private place to wash and change while at home. And then for the 4th indicator that's emerging, there's data on participation in activities during menstruation, like school, work, or social activities. And we have data on that from 34 countries. So in total, there's 42 countries with national data on at least one of these menstrual health indicators. Most of these, or nearly half, I should say, are from sub-Saharan Africa, and they're all from low and middle income countries. We didn't have any national data from a high income country. And on the next slide, we'll see some of the actual data from these emerging indicators. So for the 2 countries that had data on awareness of menstruation before menarche or at the first period, we see quite a variation between countries, but also within countries as well. So when we disaggregate by urban and rural settings, or age at menarche, by wealth or disability, we see a lot of inequalities that emerge. And on the next slide, you can see really high coverage of use of menstrual materials for most countries, but there are some countries where a significant number of women don't have a private place to wash and change those materials. In some countries, it's less than 75% of women and girls that had a private place to wash and change. On the next slide, we see data from the MIX survey, which is run by UNICEF, on participation in school, work, and social activities. And we had data on this from 28 countries, and we saw that non-participation during menstruation varied by geographic, socioeconomic, and individual characteristics. So if we look at urban versus rural, we didn't really see a clear pattern in coverage, but there were some significant gaps in some countries. So for example, in Gambia, non-participation was higher in urban settings, whereas in Central African Republic, non-participation was higher in rural settings. Looking at wealth quintile, we also don't see a clear pattern. In some countries, the poorest are less likely to participate, such as in Nepal, whereas in other countries, the richest are less likely to participate, such as in Kyrgyzstan. So there's kind of a note up here. This is kind of suggesting that non-participation doesn't necessarily reflect exclusion. It could be a lack of resources at school or work, or a woman's choice to not participate. If we look at disability, we actually see a pattern emerging where in a lot of countries, women with a disability were half as likely or more to participate in activities during their period. In some countries, this gap was really large, such as in North Macedonia, where it's a 5-fold difference. So on the next slide, just to kind of sum things up, progress is being made. Menstrual health is formally included in global WASH monitoring now. There's a separate chapter in the latest JMP report that was released earlier this year. But this is definitely an ongoing process. So further work is needed to refine the indicators, but also to evaluate if others might be more relevant. So the next presentation, Marnie will discuss efforts aimed to shortlist potential national indicators, which we're really excited about. If you want to learn more about JMP's global monitoring of menstrual health, you can go to washdata.org, click on monitoring, and then menstrual health. And there you'll see a summary of available national data, those 46 data sets. You can download individual country files that detail the available data, discuss assumptions that were made to harmonize the data between countries. And you can also download the report that was released earlier this year, and Chapter 5 is dedicated to menstrual health. With huge thanks to the experts that reviewed that chapter, many of which are on this call. So with that, I'll turn it back over.
Great, thanks so much, Christy. I would just like to encourage everybody to put their questions in Pathable if you haven't already. I've seen a few pop up there, but just as the presenters are making their way through. And then with that, I'll pass it over to Marnie.
Wonderful, great to be here, and also fantastic to follow on the 2 presentations by first Bethany laying out the definitions that we're talking about, the foundation, which really links really well with what I'm going to present on. And similarly, Christy and all the great work at the JMP that also set us up for the work I'm going to talk about. And I am following along on Pathable, and it's great to see the questions, which maybe is a benefit of online UNC conference, even if we miss being together, as we can pose questions all along, which is terrific. So what I'm going to talk about is sort of picking up a little bit in terms of how do we make progress on measuring menstrual health and hygiene at national levels. And I'm going to describe an initiative that began a number of years ago, and now we're sort of in a second phase of it, with acknowledgement to the logos all listed at the bottom of the slide for all of the great colleagues who've been working on this together with me, and Bethany's one of them, and also the work of the Global Menstrual Collective in linking us in terms of finding funding. So next slide, please. Wonderful. So I want to just go back in time. There was a lot of growing discussion, and actually similar to the comments my colleagues already made, at previous UNC meetings, we and others had tried to gather people, various people had organized side sessions to look at the issue of indicators in relation to WASH. But we also noted that there was a lack of indicators for people to take up and use and to decide were relevant and rigorous and validated for girls around the world a number of years ago. And so we got some funding from the WSSCC to hold a meeting in Geneva, a 3-day intense working meeting where we brought together global monitoring experts from the sectoral areas we thought were quite relevant, which included WASH, obviously the number one, but also education, gender, and health, and in health, thinking about sexual and reproductive health, and also psychosocial health issues. And so we came together with these global monitoring agency representatives, other measurement experts who are thinking about how to capture progress from academic perspectives, NGO perspective, other research institutions. And then we also had representatives from national governments, one of whom you will hear from at the end of this session today. And after 3 days of really thinking about what are the priority areas that WASH, education, gender, health are thinking about that are relevant to menstrual health and hygiene, and also what are the priorities for menstrual health and hygiene in relation to those sectors, we came up with this working green paper, which we can certainly send to anybody who's interested, but also this series of 5 recommendations in terms of the way forward. And then we were fortunate, and number 4, which seemed like the most urgent, one of our national level participants from Kenya noted that governments really needed something to pick up and use right away. So even though we have a ways to go in terms of identifying more valid indicators to recommend and those that have been tested, governments really, like yesterday, needed some suggestions of what to start with. And so that was number 4 in terms of our recommendations, to come up with instruments of MHH indicators, sort of top ones per subgroup. By subgroup, I mean these different sectoral areas I mentioned, ready for governments to pick up. And so we had an opportunity. The Menstrual Collective linked us and helped us to get some funding from the Bill and Melinda Gates Foundation to do a second body of work that would focus on this number 4. And so our current initiative, we're about halfway through, is to consolidate a short set of recommended indicators as is described at the bottom of the screen, along with guidance for countries and anyone who wants to use them, and then also identify areas that need further measure development or validation, which I'll talk briefly about. Next slide, please. Okay, so just very quickly, our overall process. At the beginning, our core group, and our core group was all of the institutions listed on the first slide, which are a number of academics and NGO colleagues who've been working in the menstrual space for a very long time. And so we sort of came together and thought about what would be the most effective approach for identifying this short list, which then included a huge desk review of all available indicators. And we really leaned on what the JMP and UNICEF and others had done. And then we reached out to identify 4 exemplar countries. And we selected these countries, Bangladesh, Kenya, Philippines, and South Africa, because we wanted to start with countries that already were doing something at national level to monitor MHH, and much of this is WASH. That would give us some exemplars of a possible way forward we could learn from for other countries that haven't started yet, and also we might be able to help them think about how they could expand their monitoring. So we engaged with these countries who were terrific about working with us in this process, and then from the desk review and everything we learned from these 4 countries, we then conducted a 2-week systematic engagement online, both with our measurement expert group from the 2019 Geneva meeting and with our global advisory group, which includes a much larger number of individuals around the world, and with the national governments of these 4 countries. And we came up with, as I'll talk about briefly, a sort of recommended final short list, and we are now working on and writing that up. Next slide, please. So just to backtrack briefly, and then I just want to make sure to wrap up on time. And Bethany already mentioned this sort of relevance of this, but we needed to come up with domains of how to monitor MHH. So we looked at the 4 existing definitions we could find: menstrual hygiene management, menstrual health, other iterations that are out there. And we came up with the domains that are listed on this slide. And then we mapped existing indicators and measures that were available that sort of related to these domains. And then again, as I said, we had this 2-week online process of reviewing and ranking the list that we came up with, and also building consensus with engagement from the countries on what the short list were. And I want to emphasize, for when this list comes out, we really wanted to start, and we kept reminding ourselves of this. This was key from the global monitoring experts, to start where countries are, and to start with anything we could find that countries were already collecting. And that goes back to Bethany's point about people measure what they treasure. Countries are flooded with data and data being collected. And we got really strong recommendations that start with any data being collected that will show that countries are already making some progress on monitoring, and then you can build out from there. But starting with all new indicators that no one was collecting seemed like not a very viable approach for getting uptake of measurement around MHH. Next slide, please. So just quickly, our current status, as I mentioned, we have finalized the shortlist of and related measures. We are working on the guidance note. And in the coming months, once it's finished, which hopefully in the next few weeks, we are planning to translate it into numerous language. We're hoping 6 or 8 different languages to make it really accessible. Conduct a series of targeted and more open webinars for anyone who wants to understand the process and also what the recommendation is. Do other forms of advocacy and dissemination, and then also work with the exemplar countries on action plans for how we can go help them to advance beyond what they're already doing, which is great. Next slide, please. So just thank you quickly. Acknowledgements to the core group of institutions that were listed on the first slide, to our global measures group, our global advisory group, to all the country stakeholders, and to the foundation, of course, for supporting this work.
Great, thanks so much, Marnie. Just turn my video on and off. That's a wonderful summary of the incredible work that you all have been doing. And I'll pass it back over to Bethany for a presentation on another incredible initiative. Thanks, Bethany.
Hi, everybody. Okay, we can go to the title slide. Might be just slower on my computer. So this work, which is funded by USAID, is focused on advancing metrics for menstrual hygiene management specific to those in the workplace. And I just want to quickly acknowledge and send tremendous thanks to the wonderful team at Emory and Athena Infonomics who has been working on this. Next slide, please. So as you might guess, the primary goal of this work is to adapt existing menstrual health and hygiene measures to the workplace. Many of you might know that a lot of work has been done focused on schools. So the workplace, though, is a different space. And to advance the development of metrics to more comprehensively capture menstrual needs, practices, behaviors, attitudes, and social norms relating to menstrual health and hygiene in the workplace. And if you can click ahead, the primary focal spaces for this work are in Nairobi, Kenya, and also in Kathmandu, Nepal. These locations were chosen purposively because work being done currently, also funded by USAID via WASHPaLS, and carried out by Iris Group with a DT, is being carried out there to in very specific work locations to understand women's experiences and also to test interventions to ameliorate challenges and strengthen their experiences in those spaces. And there, maybe a DT can share, but there was a poster presentation related to this work, and maybe that can be shared in the chat as well for people to reference. So actually, if you could forward a few times, the next pieces will demonstrate our process here. And so first we drafted our survey. Because this was adapting measures, we looked extensively at a mapping of different measures that were currently available for schools, not for schools, different populations, to understand what could be relevant and useful. We then had a series of experts review the draft survey and we did revisions. We carried out cognitive interviews. And so these specifically for people who might not be aware of cognitive interviews, it's essentially like a merging between qualitative data, qualitative methods and a survey approach where we ask respondents the question, and instead of simply responding, we ask them, what does this question mean to you? Can you put it in your own words? And can you explain why you responded in the way that you did? The purpose of this is to really make sure that the questions we're asking mean what we want them to ask, and also the responses seem to align with what people are saying. Now, the intention of the cognitive interviews at first was to do this with a sample of women in these communities in Kathmandu and also in Nairobi. However, COVID has been a challenge, as you can guess, with data collection, especially during the summer months. But we adapted and we carried out this work with members of our team. We trained some members of our data collection teams in each location, and then carried out these cognitive interviews with the other members of the team. Now, the sample then was a little bit less diverse in terms of the types of jobs that people had, but at the same time, we think it was a very useful exercise because it led to many revisions to the survey in that process, and also provided a little bit more exposure to the survey before these individuals were then trained to administer the survey later. So then we piloted the survey with a small group in each location in the general population. Importantly, what's been different about this work versus the work that's been going on already by IRIS is that we didn't want to confine our data collection to specific workplaces. We wanted to get as varied a population as possible. So we actually carried out the surveys in proposively selected neighborhoods, selected with partnership of local teams to think about varied types of work in different neighborhoods in those cities. And then within those neighborhoods, we randomly selected and knocked on doors to administer the survey to women in those households. So after the piloting and revision, we actually had the survey data collection, and then comes analysis. To date, we have completed the survey data collection in Kenya, which is fantastic, and it's still ongoing at the moment in Nepal. So next slide. So we have various things that we were looking for. As noted in the very beginning, the goal was to think about practices, needs. We also looked at self-efficacy or confidence, also bodily integrity. These were the core of really understanding work menstruation experience. Next slide. We also wanted to understand the various determinants of these experiences. So at the workplace level, looking at social environment, so institutional policies, physical environment, including WASH and resource availability. Next slide. And at the individual level, access to resources like materials, pain management, social support, and knowledge among the participants, as well as various demographic factors like age, education, marital status, decision-making, job type. And then next, we also looked at the biological level of individuals that could determine their experience, like pain, symptoms, heavy bleeding, and irregularity. And then next, all these experiences then, of course, can influence various outcomes. So individual well-being was something of focus, including health, both physical and mental, comfort, safety, and stigma and social impacts, as well as individual employment, like absenteeism or presenteeism, ability to complete work, earnings, advancement of opportunities, and job satisfaction. Our survey, the very first draft, included elements of all of this, but through the review process, we did end up cutting some pieces out because, as you can imagine, this was a very long survey and not all aspects were well received in our piloting process and in the cognitive interview process. Next. What we didn't measure, but what's also important are longer term impacts, like greater economic development or empowerment within these communities, as well as future revenue streams and business and workforce impact. But these are important to note and keep in mind. Now, I'm not going to share anything specific, too specific about all of these all of these measures because we're finishing up, and I don't want to jump the shark on our findings, which we will be presenting in December, but I do want to share some information. And so quickly at the next slide, we did collect also some questions related to COVID. And the first thing that I'm going to talk about is that, and you can see in the red on the side, we had completed 623 surveys in Kenya, which is fantastic. And I'm so proud of the team for their endurance. But we approached over 1,600 households in order to get that done. It has been very challenging right now to carry out data collection for numerous reasons. And so we do sort of, we are currently collecting data right now with women in Nepal. We have 300, but are also finding challenges with COVID, also coupled with flooding and rains in that space. Now, I just wanted to highlight a few points. 27% of the women we chatted with noted difficulties accessing preferred materials in the past 6 months related to COVID. And there's also been COVID-related difficulties related to purchasing materials, and this could be due to mobility restrictions. 13% said that. Shops or markets being closed, 17%. 9% reported shortages in shops, 16% said the prices were too high, and 19% indicated drops in their household income. And also there were challenges related to changing at work due to COVID. So 11% indicated difficulties accessing typical changing locations due to COVID restrictions. 16% indicated longer wait times at typical changing locations due to limitations on capacity. And 35% felt uncomfortable at typical changing locations due to COVID-related concerns. So this is important info to share just because this is the backdrop of all the other data that we are collecting. And that's an important thing to keep in mind when considering what we're finding and what we'll be sharing in the future. So that is all for me. I want to move forward to the next slide just to say thank you to everybody on the team once again, and recognize all those who've contributed to this process. And please stay tuned for more work related to this, hopefully in December.
Great, thanks so much, Bethany, and a big thank you to all the presenters. I realized I forgot to introduce myself earlier, so I'll take this moment to do so. I'm Aditi Krishna. I'm Director of Research at Iris Group, and I'll be facilitating this next session on the questions and answers. There have been quite a few questions that were posed in the Pathable chat, and some of them have been answered, specifically pertaining to definitions around participation and how to parse out attendance versus meaningful participation. Christy has answered that question there as it relates to what the JMP is measured. Considering a broader definition of menstruators aside from only women and girls, and then how to define menstrual materials, all important aspects to define when collecting and analyzing data. Christy, I know you've put the answers into the Pathable chat, and I encourage people to reference the answers there, but I wonder if you want to add any more there, or if any of the folks who answered the questions want to ask to be unmuted, and then can ask any follow-on questions live.
Aditi, do you want me to wait and see if participants want to open their mics?
Chrissy, why don't you go ahead, and then I'll watch out for anybody. I think you just have to raise your hand in order to ask any questions.
Perfect. Well, thanks for the really, really great questions so far. You're hitting on gaps that I think are really important. And I think the work that Marnie presented and Bethany presented are starting to cover some of those gaps, but some remain. So it's really nice to kind of see that discussion starting. I did see a question from Lisa asking, what proposals do the presenters have for aligning both national and donor governments around common metrics to improve comparable global data? I'd love to hear what Marnie and Bethany have to say as well. But one thing I might say from a JMP perspective is a starting point that we found is through international survey programs such as the UNICEF Mix, the USAID DHS Demographic Health Survey. So Lisa would know more about that. The PMA 2020 had questions on MH, And so integrating into those international survey programs that are available to a number of different national governments, that's been one way that we've been able to get more comparable data. But if Bethany or Marnie have something to add, please do.
Sure, happy to speak to that as well. Although I feel like I'm speaking for Bethany in relation to our project because she's very actively engaged in it. It's an excellent question. I would second what you also articulated, Christy. So in our process around these national level indicators, we have country partners. So we've identified sort of champions, which we recognize we need to grow that group, champions in each country who have been consulted, part of the analysis, engaged throughout the entire process of coming up with this shortlist. And for our and we have also intentionally, as I mentioned, selected data already being collected. Like if the DHS questions, relevant JMP questions, if countries are already collecting them, they made it onto our list because they are obviously relevant MHH. They're obviously relevant for monitoring progress on MHH. Our hope is that in the next year or longer, depending on funding, we can really build out action plans and support the exemplar countries and or find ways to support countries that haven't started. But I think what we all collectively appreciate is two things. One, you can have the best champions in the world, but moving countries along is a slow process. And so this really has to be an engaged and sustained partnership, and also with capacity building around the quality of the data collection, and also deep respect for the competing priorities around data collection. And similarly, that JMP data may not be of interest to people in the health sector. So recognizing we have very, very different actors who need to be engaged if you want to mark progress on menstruation in these different areas of relevance. I forgot the second thing I was going to say. So over to Bethany.
Thanks. I think the only other thing I have to add, which, already sort of to just echo what Marnie and Christy said, is that, we have this great data from these great sources. There are countries that have been collecting data already. As Marnie noted, we've collated that. What makes the JMP work so powerful is that they've done the work to synthesize it. They're doing the work to compare it. And that in and of itself is an advocacy move that can get other people on board. So just getting back to the original point in the very beginning of this, it's one thing to be collecting this data. We have to use it. And so using it smartly. And a lot of these countries have some of this data, and maybe they'll start collecting more of this data as we start to, keep presenting, keep synthesizing, and keep showing that it's important and that it can actually be a great advocacy and program tool.
Great, thanks so much to all of you. I'm going to ask Lisa Scheckman to unmute in case she wants to chime in as one of the champions on MHH at a national level. Lisa,
Sure. Thanks, Aditi, and thanks, Christy and Bethany and Marnie. Obviously, for those who don't know me, I'm in the Water Security, Sanitation, and Hygiene team at USAID. And as Bethany and Aditi have both mentioned, we're supporting some of this work both through JMP and through the work that Bethany presented. And it's something that we feel really strongly needs to be taken up by the global community and incentivized by donors who are actually all aligned around a common vision in order to support national government statistical capacity, surveillance capacity, interest in prioritizing this component of JMP, of DHS, et cetera. And so we've been really thrilled to see this collaborative effort, and just really keen, a lot of the questions that were posed in the chat, particularly around looking at inclusive definitions and inclusive metrics for all menstruators and not just people who identify as female, as well as, a whole other range of inclusivity, recognizing how localized menstruation-related stigma can be. There's just a lot of work ahead of us, and donors who have their own definitions, their own approaches. So, excuse me, as this continues, I just encourage us to all figure out why my allergies are acting up while I'm speaking. Sorry about that. I just encourage us to all really think about how these efforts can be brought together in a way that aligns all governments and private donors as well as donor governments around metrics that can be taken up and that look not just at sort of the menstrual hygiene management components, but the broader MHH holistic components, so that there's both capacity and incentives created for these approaches that we all sort of strongly believe need to be prioritized. So that's my soapbox. Thanks for giving it to me, Aditi. Over.
Thanks, Lisa. Appreciate you jumping in right there. There's a couple more questions in the chat. I'm going to skip over them for now and ask the presenters to address them in the Pathable chat. One is relating to the mapping of measurement tools, and just a quick response here to Priyanka is that we anticipate having a partial answer to that through some of the work that's coming out of the USAID WASHPaLS work on MHM. And Rolf has a question as well that I see already an answer to there, so that's great. And as we're running short on time, I'm going to move us on to the next lightning round section, which focuses on 2 recorded presentations from Jackie Haver of Save the Children and Julie Hennigan at the Burnet Institute. Both of them have, as I said, recorded their presentations. So any questions that you may have for them, I'll ask you to put in the chat, and we can get back to you all on answers to those questions in the coming days. As you're also listening to those presentations, I just want to get your minds thinking about the next audience engagement session that we have, which is to highlight what are the gaps that need to be addressed in MHH based on your own experiences. And relatedly to identify areas of work that you all are maybe engaged in to address those gaps. So if you could put those in the Pathable chat and also note whether you'd like to speak live, we can work to get you unmuted so that you can share those with the community gathered here. So without further ado, we'll move into to the presentation by Jackie Haver.
Hello, I'm Jackie Haver. I work for Save the Children US within the Department of Education and Child Protection, and I'm based in Toronto, Canada, but unfortunately I have a conflict at the time of this presentation, so unable to join live in the panel. This presentation will discuss the MENSES tool, lightly cover development of the tool, but more so focus on lessons learned from piloting and testing across a number of countries. We have learned that high-quality implementation of the MENSES scale and training for enumerators is essential in gathering quality data. Over the last 10 years, menstrual health and hygiene has been integrated within over 20 projects across Save the Children's school health and adolescent sexual reproductive health portfolios. The countries listed in blue have been a part of the development and informed lessons learned from piloting the MENSES tool. I will be drawing on these experiences for this presentation. As MHH experts based within an education team, we started to think about how we could measure outcomes that might be somewhere along the causal pathway between poor MHH and absenteeism. These domains of interest were very common across countries in the qualitative research, which is why we selected them. We thought we might not be able to attribute reductions in absenteeism to menstrual health and hygiene programming, but we could potentially show that we are improving menstruators' participation in school, lowering menstruation-related stress, and increasing self-efficacy, thereby potentially changing behaviors that could lead to absences. Our research objective was to determine whether we could measure these domains. Menstrual-related school participation uses items related to answering questions in class, an ability to concentrate, even skipping class. Menstrual-related stress examines negative emotions, as we've heard girls describe fear, anxiety, or teasing. And menstrual-related self-efficacy is an important element for behavior change. Do girls believe in their own capacity to take an action? These research questions have led us to the MENSES tool, measuring menstrual-related engagement, self-efficacy, and stress. The process we've taken to develop MENSES started with qualitative research in 2016 in the Philippines and El Salvador. The qualitative data was analyzed and used to create quantitative items or survey questions. Those items were first piloted in El Salvador, and as you can see, after each assessment, we have made edits to the survey to the items, response options, etc. And within the pilots, we conducted cognitive interviewing to understand how the items were being perceived, and psychometric analysis on the data sets has been performed using exploratory factor analysis and confirmatory factor analysis as part of the scale development. But for today's session, I will not go into these details. The process has been slow, mainly because Save the Children is not a research institution, and this has been an initiative of a small handful of folks. But we are looking to expand and for research partnerships. And finally, COVID school closures have slowed down data collection opportunities. So qualitative data was transcribed verbatim and analyzed using the MAX QDA, and the domains of interest were coded, and then each domain was analyzed separately to understand the various facets that define school participation, stress, and self-efficacy for girls. We used the findings from each domain, including many direct quotes, to develop survey questions. The tools were separately developed for the Philippines and El Salvador, including about 20 to 30 close-ended survey questions per domain of interest. We then compared survey questions between El Salvador and the Philippines to add or subtract items to create one tool for both locations. The figure with the arrow illustrates the qualitative question, the findings, and an early draft version of the survey questions. We really tried to use girls' own words as much as possible when developing the tool. Here you see sample questions from each of the MENSES domains. After experiences from the El Salvador pilot, we differed responses based on the domain's questions. You'll notice that the self-efficacy domain has 4 response options. We modified the Likert scale from 3 responses to 4 responses after the Kyrgyzstan use of the tool showed that there were ceiling effects in many of the questions. Because MENSES has been applied in multiple countries and in multiple programs, we've nested it within other surveys. This slide gives you an overview of the demographics of the girls who would take the survey and what other topics might be included in the survey. What's important to mention here are that we are including some basic demographic questions. So in the Philippines, we were identifying family members that also lived within a household. In Mexico and Philippines, we included proxies for socio-economic status. We usually also include other CAP questions on topics that both girls and boys, regardless of their menstrual status, can answer so that we are not being exclusionary. And in the Philippines, we included some reading comprehension questions, again in an attempt to test our hypothesis regarding the link between MHH and education. We've had the most success when using MENSES with very young adolescent girls, so ages 10 to 14, and we've tried to keep sample sizes to include girls from only 1 or 2 grades, or focus more so on age of respondents versus grades. This is particularly important when working in contexts where age for grade may not be accurate. We found in our pilot in Ethiopia there was a very diverse age range, although we were only sampling 2 grade levels. We also try to over-recruit girls for the sample as we do not pre-identify which girls have reached menarche. All assented girls are able to answer a selection of questions, and those that wish to continue and have reached menarche go on to answer the MENSES questions. We do this to ensure no person feels excluded or shamed during the data collection. And as we've been working to refine the MENSES tool, we've learned along the way how essential thorough training and guidance for applying the tool is for quality data. As an NGO, we like to collaborate with academic institutions to ensure rigor when possible, but in reality, it will not be feasible for all applications of the tool. So we developed thorough planning and training guidance to accompany the MENSES scale. The toolkit consists of 4 training modules and 3 additional training modules. The core modules consist of 7 training presentation slide decks covering MHH 101, the study design and survey methods, a session on understanding self-efficacy and how to measure it, research ethics and child safeguarding, roles as a data collector, electronic data collection, orientation, and planning for the pilot and data collection. There's also 6 accompanying handouts, a training agenda template for trainees, and a training agenda and instructions for the facilitators. There's also a preparation checklist that can be used to update the slides with the information relevant to the specific the data collection project or context. This is an example of the training workshop agenda we used in Nepal. I'm going to highlight 2 of the most important pieces of the training. Circled the self-efficacy deep dive. After the first pilot in cognitive interviewing in the Philippines, we realized that we needed to spend more time unpacking the concept of self-efficacy and how it relates to MHH with enumerators. For the application of MENSES in Kyrgyzstan, we developed a self-efficacy session. Within the self-efficacy session and others, we also spent time on translation of terms that would be understood and comprehended by girls in upper primary and lower secondary school. While the tool is normally translated in advance of the training workshop, we still spend time going through the intentions of each survey question and consider whether the translation correctly represents that and is in language that is age appropriate. This is a slide from the training. With MHH, we talk about self-efficacy, not necessarily self-confidence, because we can affect a girl's self-efficacy to tackle menstrual-related challenges at school. We as Save the Children have the power to instill girls with the skills, knowledge, products, and infrastructure necessary for her to have self-efficacy when she's managing her period at school. So during the enumerator training, we conduct a number of exercises to understand the concept and importance of self-efficacy for girls during menstruation. Within one activity, enumerators map out a girl's day when she's on her period to see how it's different from days that she's not on her period and understand where her self-efficacy can help her tackle those challenges. Circles highlight the inter-rater reliability practices that are built into the training. The first pilot we did involved only 3 enumerators, and they were very in sync on everything. The next round involved more enumerators, and we found we needed to work a bit harder to ensure they were asking and filling out the responses to the survey questions consistently. As a training activity, the enumerators pair up in 3s. One person pretends to be the girl responding to the survey, one person is entering the responses into Kobo as the enumerator, and one person is entering the responses into Kobo as an observer. We're then able to see how consistently the 2 enumerators entering the data understood the responses. Throughout data collection, we continue to check the IRR by working in pairs for about 10% of the sample. It also gives each enumerator a chance to pretend to be an adolescent girl answering the questions, strengthening their compassion and empathy for the survey respondents. In the trainings, we spend a great deal of time working together to build up a sense of teamwork and ensure the questions are being asked similarly across enumerators. We are also trying to build a sense of heart among the enumerators, helping them to view the data collection as more than a one-off job, but a way to make an impact on the girls in their communities and globally. We've seen anecdotally and in the quality of the data that the more the enumerators care and take pride in their roles, the better the quality of the data we collect. So we work hard in the trainings for the enumerators to internalize the important role that they have in data collection. We've also tried to recruit younger adult females as enumerators so that adolescent survey respondents are comfortable during the interviews. A quick recap. Among the lessons learned, we feel that the quality of the training on the MENSES tool matters, that self-efficacy is a difficult construct to translate and explain to VYAs, and that younger female enumerators that care about the data collection make the best enumerators and contribute to quality data. Our next steps include continuing to collect MENSES data and compare with the Philippines and Mexico, identify opportunities to collaborate on tool use, and to publish the psychometric analysis from the tool validation, and to finally make the MENSES tool and the training resources available open access. This has been a journey, and we thank everyone that has been involved in this process over the years. And for any questions, please don't hesitate to reach out. Myself and my colleagues that have been collaborating on the tool development would be happy to be in touch.
Hi, everyone. Just chiming in live in between the recordings. Thanks very much to Jackie in absentia for that presentation. And then over to a video from Julie Hennigan.
Hello, everyone. It's fantastic to be connecting with you remotely from Australia. The session today is covering a range of different measurement topics, how we monitor at national levels, the challenges of field testing questions and measures for use in different efforts. While there are many gaps in the measures available and being used, there is also exciting progress being made. Today, I'm going to talk briefly about the Menstrual Practice Needs Scale, which we released in 2020 and continue to appraise. The development of the MPNS has been a multi-step process and reflects the stages of development for really any measure of this kind. Phase 1 was about conceptualization. Before we can develop a measure, we need to have a really clear idea of what it is we want to measure. We want the concept that we're trying to measure to be clear and to be grounded in our knowledge of the topic. We also want to understand how we believe it relates to other relevant concepts and outcomes that we're interested in. In developing the Menstrual Practice Needs Scale, we started with this big systematic review and synthesis of qualitative studies, capturing women's and girls' experiences of menstruation across low and middle income countries. This gave us a nuanced understanding of the different themes, concepts identified through this body of research, and to develop a problem theory about how they're connected. In our measure development work, we then determined that there are multiple concepts that we might need to measure. And we prioritized menstrual practices. In interviews, women and girls talked about the actual behaviors that they were undertaking to manage menstrual bleeding. These were important and frequently had been measured, although inconsistently in quantitative research. We also identified this other theme that women and girls didn't just talk about what they did to manage menstruation, but also how they felt about their management practices and the extent to which these and their environments were satisfactory or were meeting their needs. We did develop measures for both of these concepts. So the Menstrual Practices Questionnaire provides guidance around measuring self-reported management behaviors. I'm not talking about that measure today, but it is available online. And the MPNS, which measures respondents' perceptions of their practices. I also think this is a nice example of how the way we identify and define the concept really influences our measure and our understanding of the topic. For example, when we measure menstrual practices, we measure things like the type of material someone uses or the number of times that they change it in a 24-hour period. In contrast, in the MPNS, and if we measure users' perceptions of their practices, we measure if a respondent is satisfied with the material they're using, if they're able to change it as often as they want to, or as often as they feel is needed. Both of these are consistent with topics reflected in the qualitative research, but they're different constructs that give us a different window into this issue, and we might hypothesize are differently related to various outcomes that we've identified, like health and well-being or education. So at the end of our conceptualization, we've defined the Menstrual Practice Needs Scale as measuring the extent to which respondents' menstrual management practices and environments were perceived to meet their needs during their last period. And we have hypotheses around the way this concept fits with the broader menstrual experience and related outcomes. Phase 2, once we've established what we're measuring, we need to develop a candidate tool that measures that concept. We developed a series of questions to make up a scale. The questions were informed by our qualitative review as well as past research capturing the variety of blood management needs that had been reported and were important. We also undertook a survey and consultation with experts, as well as gathering lessons that had been learned from question approaches that were being used in different research and monitoring efforts. Phase 3, after developing the candidate questions, we then needed to test and construct a final measure. For scale, we have developed a series of questions that we think fit together to capture this concept, this complex, multifaceted concept. We want to test the dimensionality of that scale so that the questions do actually fit together, and to test if they have different concepts or subscales within them. We also want to understand if the questions making up our scale are answered with internal consistency. And very importantly, we want to test the validity of the scale. That is, do we believe our scale is measuring the concept that we intended to measure? In testing the measure in a sample of adolescent schoolgirls in Soroti, Uganda, we identified 6 subscales or dimensions of menstrual practice needs. This included perceiving needs as being met around materials and the home environment, transporting materials in the school environment, and needs around laundering or reusing materials, as well as worries about the reliability of materials, insecurities around changing and disposing of materials in various locations, and around laundering. We also found good reliability and validity for our subscales and measure. And in the interest of time, for more details around the original validation, you can see the measure website or the original publication. So at this point, we've published and shared our measure so that others can start using it to further test performance and to start measuring this concept, consistently across different efforts. But we have only undertaken our evaluation in this one population of adolescent schoolgirls. So as the tool is used, we want to evaluate the MPNS in other groups. We want to test and adapt or refine as needed for other contexts or languages and other age groups. We did this recently using data from the Women in Workplaces study undertaken in Mukono district, Uganda. In this study, we used the MPNS to help us understand menstrual experiences of women working in market schools and healthcare facilities. This also provided the opportunity for us to test the performance of this measure in this group, a very different population from the original development. We undertook cognitive interviews with women to check how they understood the items and interpreted them. We found that the population really well understood what we were asking and that their interpretation was what we had intended. And their answers were also really helpful in understanding the many different considerations at play that contribute to how women feel about their practice needs and whether or not they're being met. In testing the dimensionality of the scale, we found that for the adult sample, an alternative subscale structure was a better fit for the data. This was broadly similar to the original identified with adolescents, but for adolescents, their satisfaction or sort of needs met around their practices and environments grouped separately from their insecurities and worries about these needs. For adult women, there was much greater alignment between their satisfaction with their practice needs and their worries or insecurities about things like having enough material, privacy, and safety. So we had these 3 subscales that were updated, home and material satisfaction and insecurities still grouped into separate subscales, but then all disposal needs and insecurities, as well as workplace needs and insecurities, were captured on their own subscales or represented their own dimensions. This makes a lot of sense when we consider that adolescents in our original sample are quite new to managing menstruation, whereas adult women have had a lot more time to calibrate what they have and what they're concerned about in terms of their menstrual management. We also found good internal consistency among the scale questions for our adult sample, and we found that the total score and subscales were associated with other concepts in the way that we expected. So with poverty, mental health, missing work, and confidence managing menstruation at home and at work. So for example, those with greater levels of poverty also had fewer of their menstrual practice needs being met and had lower scores on the scale. There's a lot of detailed information about our testing in the preprint that we've shared along with the session material for those who are interested. I didn't have time to go into all the detail in this presentation. But in sum, we found that the MPNS is a useful tool to measure menstrual experience and the extent to which blood management needs are being met in both adolescent and adult populations, with some adaptation to the subscales to best capture the experiences of these different age groups. In next steps, we continue to evaluate the performance of the measure in adults and adolescents in different contexts, and to explore establishing a shorter form of the measure to see if we can achieve similar validity with a potentially reduced tool. As others will likely emphasize in this session, high quality implementation of the scale and training for enumerators, I should flag, is also really key in being able to use the scale effectively and in gathering quality data. So I know I whizzed through a lot. I wanted to give a sense of the scale for those who may not be familiar. There is a lot more detail in the original publication and preprint on the revalidation, as well as the MPNS being available for download and more information on the Menstrual Practice Measures website. I'm also very happy to answer questions via email or Twitter or other forums. So thank you very much for your time, and back to the session coordinators.
Thanks very much to Julie again in absentia for participating and presenting on her work and the work in collaboration with a larger team. I wanted to leave the questions that I had posed with you all to consider and to continue populating in the chat if you're interested, and move us along in consideration of the time to the closing. So I'm going to pass it over to Marnie to close out the session on measuring menstrual health and hygiene. Over to you, Marnie.
Thanks, Aditi. We're going to watch one more video as part of this closing. So just to sort of wrap up with a few thoughts. One, even though I was involved in the organizing of this session and saw all the presentations when they came in, I am really quite struck in listening to everybody and hearing more specifically, sort of the live presentations, what a thoughtful and sustained body of work is currently happening in the realm of measuring menstrual health and hygiene. And for those of us who are a bit of the old timers, to see how tremendously far we have come is really quite remarkable. That said, I think what our collective presentations show us today is that we all deeply care about both seeing menstrual health and hygiene better captured in sort of how are we making progress towards addressing the needs of those who menstruate, but also that it needs to be done in a really quality way to have meaning and to hopefully then go on to shape policy and practice in country. And so I think we've had exemplary talks about all the various many steps that go into that effort. And I hope that I'm sure those of you watching already are aware of how complex and time and resource intensive it is to have quality measures and to have them collected in a meaningful way and a thoughtful way. But I think that is really where investment needs to be to see the long game in terms of us wanting to make sure there is quality data going forward and an expansion of the data so we can better understand both the challenges but also the effective solutions. So I do hope that the resources and the time will be made available to those working very hard to make sure we can find better ways to measure what is happening in this space. The second thing that is probably more a point of discussion, and then we have one quick little video to watch before we really end, is that I think there will continue to be a tension between this desire to have the box of things that we measure in menstrual health and hygiene and the way in which countries and donors actually work, which is very sectoral, which is not to say sectors don't talk to each other or don't try to collaborate, but the education sector, the WASH sector, or the water sanitation sector, or the water or the sanitation, or the sexual and reproductive health, they are continue to have their priorities they need to meet in terms of sort of national level outcomes and the SDGs. And I think it is for us to help facilitate the inclusion of relevant indicators and measures in their sectoral spaces, because trying to take on and have them all see this as this MHH collective goal may be not the most effective way to see things really transform in countries. I think we have to fit into the way countries operate, which doesn't mean we don't want to see them improve their practices, but I just think that may be a more realistic way for us to see progress made in this space. Although I know I'd probably get 600 hands if we were actually in North Carolina together on that comment. That said, I think what is a nice sort of wrap up short video, we have our colleague Neville in Kenya kindly put together a short video. Neville has been working tirelessly in the Ministry of Health in Kenya on the water sanitation, but also sexual reproductive and other spaces, trying to see progress made in terms of measuring and assessing attention to MHH in Kenya. And so he's done a video about what better data means for him in the context of policy. So if we can just move to Neville's video.
Hello, everyone. My name is Neville Okparo, and I work at the National Water and Sanitation Hub at the Ministry of Health, supporting the ministry in matters of monitoring and evaluation, and also work as menstrual health and hygiene champion at the Ministry of Health. And as most of you are aware, as a country, we develop a standalone menstrual hygiene management policy. And while we are starting off the development of the policy, we had to gather a lot of research and data to convince policymakers that this is an issue that was worth getting into. Without data and also the researches that we've done, it will have been very difficult for us to give the aspiration that we want, that is the development of policy. And Kenyan government, as an example, has for quite some time been having interventions not based on research, based on assumptions. And based on these, they will apportion funds to these interventions, but these interventions will fail in the long run simply because they were not guided by any evidence. Also, research was not there. But right now, as a country, I believe that we've gotten to a point that we've seen the importance of research and data generation in the development of interventions, because we've realized that without this research, then automatically our interventions will not work. This research and evidence will help us as a country in moving in the right direction for interventions, and also looking at how is it that we are able to leverage on some of the best practices, address some of the bottlenecks, and also look at how we are able to adapt the various studies to fit the various situations in our country. And when it comes to menstrual health and hygiene, we will really welcome we will really appreciate if we had indicators that are able to measure activities based on menstrual hygiene management in various spheres, that is both at the national and at the sub-national level. Because without that, then it will have meant we cannot assess whether we are making progress or not. And also at the same time, we cannot know which improvements we'll need to make in this particular program. And we can also not know whether our interventions are bringing the desired outcome and impact. So it's very much important that as we work as practitioners in the menstrual health and hygiene space, let us desire that we are going to give data and research more funding and also share our findings. It is this that will, in the long run, assist us in matters of menstrual health and hygiene. Thank you.
Hi, so fantastic to have Neville's inputs all the way from Kenya, although I do believe Neville online. So if you have any comments or questions for him, please just put into Pathable. I just wanted to wrap up today's sessions with a few sort of insights from Neville's talk, and then we will say our farewells to you all, but hope that you'll find each and every one of us if you have questions or ideas as we go forward our respective work. And I know we all want to hear what others are doing. I think what Neville so beautifully highlights is what countries really need in terms of making sure they can have impact in the limited resources that any national government has. And he has articulated it in such a beautiful way that it isn't just at national level, but it needs to be at subnational level as well. One of the things when I did my presentation about 45 minutes ago and indicated the key recommendation that came out of our national level, sort of our priority setting meeting in Geneva a few years ago about how countries really needed something to take up now so they could begin monitoring. Neville was a huge sort of convincer of all of us that that was really critical to do now, and also that we needed to convey which indicators really were a priority given the multitudes of data that countries are trying to collect or expected to collect. I think that comes back to Bethany's initial comment at the beginning that people measure what they treasure. And I think we want to convince countries that addressing menstrual hygiene, health and hygiene is something to treasure, but also recognize that we should only be expecting or asking or hoping that countries will collect data that really will improve the way in which they channel investments, because they are tackling so very many issues across all sorts of topics. And so we need to be realistic and thoughtful in what we'd like to see assessed and that we ask of governments. So I think that's all we have for today. Just tremendous thanks for everybody who spoke so beautifully, to our wonderful participants. And I do hope you all will, to Aditi and Ashwara who led behind the scenes and making this all happen. And we do hope to hear from all of you through our emails or see you popping up on other UNC sessions in the coming days or whatever's left. So thank you.